I'm Dr. Caroline Glicksman. I am the immediate past president of the Aesthetic Foundation, and I am in practice for about 32 years in Seagirt, New Jersey. My father was a radiation oncologist, and he actually began the first radiation therapy department at the Royal Marsden Hospital in London. My mother was a nurse. When I was 17, my father worked in Providence, Rhode Island, and I was able to get a job in an infectious disease laboratory. And then the second summer, when I was close to 18, I went to London and worked in the institute where Fleming invented penicillin, which was a fantastic experience to work in a very old laboratory in infectious diseases. And so it was really those who worked in the laboratory that showed me how to gather the data and then be able to publish your data after you've finished your studies. When I started my training in general surgery, my initial goal was still considering orthopedics. But I would say if I ever had a limitation, it would be a physical limitation, okay? More than mental, it was physical. Being 5 feet tall and less than 100 pounds, trying to lift those big football player knees, I think I realized. And having a husband who's an orthopedic surgeon made me sort of snap into reality that unless I wanted to do hand or pediatrics, at the time, I was really physically limited. I rotated as a third-year general surgery resident on a plastic surgery service. I loved the instruments, I loved the fine work, I loved the detail, I loved every case I went to, and basically that was it. I knew that was the field that I had to go into. At the time that I was a resident, there were predominantly male plastic surgeons running the show, but I had an edge with the patients. I was probably the first one in the room to talk to the patients. I was the last one to answer their questions. I realized that I really wasn't going to have a problem when I went into private practice because as a woman in plastic surgery, I think I had sort of that just little bit of an edge with my female patients. I would say the very earliest first mentor in plastic surgery was John Tebbets. He had a soft spot for women, he really did, as far as patient care and education and making sure they had safe surgery, but also bringing me on board on panels. And like I said, that was the first surgeon to ever invite me to a panel, an all-male panel, of course, but I was invited to that. My real heart was with Scott Spear. And I don't want to get choked up, but Scott Spear really educated me, and he is who taught me the most. I wanted to learn to be as good a surgeon, but also the research he did, and how he always said the data is the data, let it speak for itself. So I would say Scott Spear, and my dad, of course, I can't forget my dad, but Scott Spear in plastic surgery was probably my biggest role model. I try to mentor as many students as possible, where I can give them the opportunity to shadow me in the office and come into the operating room. There are certainly students who come in thinking they want to be in plastic surgery. They have no idea of the rigors of general surgery training and plastic surgery training. Plastic surgery is surgery. We are surgeons. We are from head to toe surgeons, and it's years of training to take care of that entire patient. So I think sometimes I just have students come in and I clear the air for them. Don't go down that path. Go into maybe something that's less involved and get to the same place of aesthetic medicine, but to be a plastic surgeon is to be a surgeon, and it's a long road. The way the foundation works or the Aesthetic Society works is you start at the committee level. If you work hard, you move up. If you're persistent and you show up at the meetings and you get the jobs done, you move up in these societies. So starting as a scientific research committee member, moved up to the chair, ran that, and then moved up to become one of the officers at the what we called ASERF, which was the longer name for what we now call the Aesthetic Foundation. I had a few goals. My first one was really to develop a significant and respected breast implant registry. So we had a registry in place, and we've really bolstered it and have grown this registry to over close to 60,000 devices. So I'm very proud of that. The ARISE registry is a huge accomplishment. The second, more personal goal I had to do with our mentorship program. I mentor students here in New Jersey, and we realized that there are probably almost 115 medical schools in the United States that do not have a plastic surgery program, and these students have no exposure to plastic surgery. So we realized there's a lot of students out there at different schools who also needed an opportunity. And this past year, we expanded that mentorship program to reach as many students throughout the country that we can. We also have a third part of this mentorship program, which is what we call a research collaborative. It's all online. These students have the opportunity to publish and to collaborate with other students and mentors around the country. We're connecting students and plastic surgeons and giving opportunities to those students who would never have the chance to set foot in a plastic surgeon's office. I was extremely fortunate this year to have a co-president. So the Aesthetic Foundation and the Aesthetic Society presidents this past year were both women. Mindy Hawes and I have been friends for years. When we started out, we had no idea how involved it was, but by the end of the year, we really had a good flow going. I think leadership, obviously you need some skills in communication and mediation and cooperation and all the things we learn in leadership training. But most importantly, what I realized is it was the administrators. The two women I worked with at the society level who were there for me night and day. I've been chair of a lot of meetings over the years, and I have to pick faculty. I will always try to ask women to be there. I want 50-50. I mean, I appreciate the young men too, they need a chance too, but I'll ask young women, and the typical answer I'll get is, oh, my kids, I have to take them off to summer camp, or I have something I have to do and I really can't leave, I've got a brand new baby. And you know what I say to them? I asked you this year, I'm asking you again next year. Plan ahead, and next year maybe you can say yes. Because you can have it all, you just can't have it all at the same time. That's really what I believe. And so when those women say, no, I just can't do it this year, I say, well, you're really good, and I love the work you do, so I'm gonna ask you again next year. And I'll do the same thing, whether it's a paper or it's a committee or whatever, just ask them again, because it may not just be the right time in their life, but I don't give up on them. I would say that my abilities are recognized among my peers in the United States, at the residency programs that I'm a traveling professor and I go and teach. I think that it's well recognized by the publications I've done and the contribution as past president. What I do notice, though, is international travel. There are times when I'm at a meeting and there'll be a group of male surgeons, older male surgeons generally, who will just look down at my name tag and go, so who are you? And I'll say, well, I'm actually the person whose papers you just presented, the 5 publications that you're quoting. My friend Pat McGuire and I actually wrote all those papers. So there are times when it's still, I think, a bit of an old boys club in Europe, South America, Asia, where I see that the women plastic surgeons who are on the panel with me have worked really hard to get to where they are. The very first time I was invited on a panel, I memorized everything I had to say, but it wasn't until I was sitting on a panel and I was asked a really difficult question, and Scott Spear kind of leaned over and he said, you know what, kid, you're here for a reason. You have something to say. And knowing that, yeah, I knew more than the guy in the audience, and I felt confident. And then learning to give talks, and you just get used to it. And I'm nervous all the time, but it doesn't really show when I'm up on stage. Yeah, back in 2007, 2008, we were doing a lot of early education, just sort of trying to get some video content onto our websites, which were just beginning at that time. And Bill Adams sat down with me and said, we're going to start something called the Plastic Surgery Channel. And we built our very first studio, and we started to bring in surgeons from around the country, where we had our own panels, and we would discuss different topics and how we educated our patients. And each surgeon had the opportunity to maybe 2 or 3 times a year add more videos to their websites. And that was really, I mean, it's all video nowadays. This is before Instagram and TikTok days. But this is the studio, and we're still flourishing. As a woman plastic surgeon, I think it's all about your age. I have been a young mother, and I have had 4 kids, and I know what that does to your body. And then I've also been a menopausal female. So I've been through all of those phases and aging and just being able to relate to the women at every age now. I used to think I knew it until I got even older, and then I'm at that age, and I could see the effect of time and aging and how it makes you feel as a woman when you walk around and just looking in the mirror. And I think from an aesthetic standpoint, what can we fix? What surgeries will help you feel better about yourself? Of my leadership positions, the most important role is raising 4 children, okay? I had 4 children in 5.5 years. I think when you decide that you're going to sort of try to balance work and family, you better pick a good partner. Okay, I could not do it without my husband. So having a good husband or partner, whatever you have, it's really important. Somebody also who shares your goals. To my younger self, definitely party less, pay attention more, read more, and probably just keep the path I went on. I mean, just keep persevering. When people say you can't do something, I always thought in the back of my head, oh yeah, I am. I'm gonna do that.